Let's talk health care. Where are Republicans today on their plan to repeal and replace Obamacare? The man with an answer is joining us now. Republican Congressman Michael Burgess of Texas. He's chairman of the Energy Committee, and he serves on the subcommittee helping to craft the new GOP health care proposal. Good morning, Congressman.
Good morning. Technically, I'm the chairman of the subcommittee on health on the Energy and Commerce Committee.
Thank you for that correction. I'll fire
Sure.
someone later for ready.
That's all right.
Okay. Meanwhile, Congressman, give us a status report. I mean, we had heard from Reince Priebus, the chief of staff, as well as President Trump himself, that they were anticipating a vote this week on whatever the new and improved GOP plan is to repeal and replace Obamacare. Where are you with it?
Well, of course, the plan is, as it passed out of our subcommittee, actually now a month ago. I think the name was the American Health Care Act, and that is still the proposition that's before Congress. Now, during the 2 weeks that we weren't in Washington, our subcommittee provided technical assistance to anyone who thought they might have an idea that they wanted to get drafted in terms of an amendment, but this will not be an entirely different piece of legislation. It will be building on the bill as it left committee, again, 3 or 4 weeks ago.
Okay, but I mean, are you really going to have a vote this week?
Well, the first evidence of that would be coming to the Rules Committee, and the first evidence of that would be an amendment that was made public. So
no.
I can't. Well, you could technically, but I would expect if something is going to happen, I would expect it to be next week, not this week. But I've been wrong on that projection before. And I'll just say this: I think there's broad recognition that we need to get something done, and the time for arguing with ourselves is drawing to a close, and we are going to have to put a bill on the floor and take a vote.
Yeah. And I mean, before I get to the substance of that, I just am curious about the timeline. I mean, do you think this is a realistic timeline that you would have something to vote on this week?
Well, the realistic timeline was doing something in February, so I would. It is time. I mean, look, the health care part of the Trump agenda is important, and it is the key that gets us through the door to other stuff. The key to the Trump presidency, I've always felt, is going to be jobs in the economy. Tax reform is, of course, a big piece of that. Health care, they say, comes first. Okay, let's get our work done. Let's move on then to helping the economy, because let's face it, if there's not a significant growth in the economy, then all of this other discussion just becomes an academic exercise.
Yeah.
We need growth in this country.
Are you getting pressure from President Trump to get this done?
Me individually, no, but certainly I know that I know they're interested, and I know they want this done. And this was something I was with then candidate Trump in November when he campaigned in Pennsylvania, and this was clearly something that he wanted to get done, and he wanted to get done early. He saw there was a problem. He saw people were hurting because of the current policies, and he wants that fixed. I do too. I agree with him. It needs to be fixed.
So, Congressman, explain to us in layman's terms, if you can, how it will be possible that the House Freedom Caucus, the conservative Republicans, and the so-called Tuesday group, moderate Republicans, are ever going to find common ground. I mean, I know that there are representatives from each, MacArthur and Meadows, working to cobble this together, but it seemed as though you were really at loggerheads with these two groups. So now how this week are they going to find common ground?
Well, number one, we're all Americans, and then we're all Republicans. So this is a discussion that has basically been going on within the family, and is it resolvable? And I believe that it is. And a credit to both groups who've worked very, very hard over the last couple of weeks. And again, our subcommittee has been providing technical drafting assistance to trying to put their ideas into action, put them on paper so that they can be considered by the larger conference. But whether those amendments are adopted or not, I do feel it's time for us to move forward and get the bill that passed out of our committee, which basically was it was a good bill, and I've heard more and more people say that over the past 2 weeks. I think there is a growing consensus that the product that passed the Energy and Commerce Committee, the Ways and Means Committee, and then came to the Budget Committee, I think it's time for it to have a vote on the floor.
But wasn't the sticking point in that bill, one of the sticking points, the essential health benefits, that some people wanted them gone and some people wanted them kept? So where are you now with those?
Well, I think that's one of the objects that's under discussion. And look, for giving governors more flexibility in states, I'm all for that. That was a big part of the Medicaid reforms that were tackled in the bill, and giving the governors the flexibility of block grant, per capita allotment, threading the needle between Medicaid expansion states and Medicaid non-expansion states. So all of that was very important groundwork which was done in the base bill. I have not had a lot of governor's offices calling me and asking for a waiver for essential health benefits, but if that's part of the discussion, I welcome their input, and certainly we may hear from more governors and more state offices as this week goes on.
Okay, Congressman Michael Burgess, we will be very interested to see what you all come up